Hi, I'm Dr. David Harrington with Michels and Gauquie, Cosmetic and Family Dentistry. I'm very excited to be here today to talk to you about dental implants.
For someone hearing about dental implants for the first time, what exactly are they?
So dental implants are a replacement for missing teeth or teeth that may be diseased or damaged that would not survive long term or be functional for a patient. In a nutshell, the dental implant itself is a replacement tooth root. And then from there, we can, once the implant is healed, the replacement tooth root can be used to attach multiple things to the top. We can replace single teeth. We can replace a whole row of teeth. It depends on what the patient needs, and we have the expertise to help the patient figure out what is the best option for them long term.
What makes dental implants different from other ways of replacing missing teeth?
Yeah, dental implants are a very strong, long-lasting solution for broken or missing teeth. Uh, when we talk about the options to replace dental implants, uh, sorry, when we talk about the options to replace missing teeth, there are several. What we find most often is that patients prefer to have something that stays in their mouth permanently. Dentures or partial dentures are replacements for teeth, but they go in the jar at the end of the day. And they can move around and get food caught under them. Patients generally don't like that for the long term. A dental implant is a fixed replacement, stays in the mouth, is independent of the teeth around it in most cases, can floss like a normal tooth, and can function just like the tooth that was there originally. When you hear about a dental bridge, that is a fixed tooth replacement, stays in the mouth, but it does depend on the natural teeth around it. Sometimes that's not a good solution if patients are missing many teeth or prone to cavities or grind their teeth a lot.
Who is typically a good candidate for dental implants?
Many patients can be good candidates for dental implants, even patients that have heard that they may not be in the past. We have done many, many hours of training all over the world. For example, I'm a fellow with the International Congress of Oral Implantologists and have learned many ways to rebuild jawbone or rebuild a situation in where we can provide dental implants to patients that may even have heard in the past that they are not good candidates.
One of the biggest concerns people have is discomfort. What is the implant process actually like for patients?
Uh, yes, I hear that concern a lot. In my experience, the dental implant process is not as painful as many people expect it to be. And I often tell patients that the dental implant, the actual replacement, is not nearly as painful as the condition they had when they lost the tooth. We have many tricks through study and experience to make the path, to make the restoration much less painful. For example, we'd use the patient's own blood and own bone sometimes to rebuild in areas if we need to augment the bone or the jawbone to make a better foundation for a strong dental implant. I do like to often point out to patients that the dental implant process is often not an overnight process. And one thing that we like to do is ensure that we are operating in a way that the patient gets the best possible long-term solution and outcome, even if that takes a little longer or multiple stages to do so.
How long do dental implants last?
Dental implants should last a very long time. It's difficult to put a number on it exactly because the patients and the situations are often so different. What we try to ensure here is that we use our experience and expertise to make sure that the patient's investment of time, money, and effort pays off in droves and lasts for many, many years and hopefully forever.
I've been missing a tooth for a long time. Are dental implants still an option for me?
Yeah, I'm glad you asked that question. The short answer is yes, dental implants can still be an option for you. In fact, we will soon have another video coming out that explains bone grafting, which is a way that we can rebuild the jawbone even when a tooth has been missing for a long time. We've studied a lot, we have advanced the technology, and we can still do dental implants many, many times, even though a patient's been missing a tooth for a really long time.
I've been thinking about dental implants but haven't taken the first step. What would you suggest?
Your first step is to call us right away at Michels and Gauquie. We are always excited to get you right in for a free consultation, meet you, discuss your options, and find the path to get you to your best smile.